Evening, I'm Chuck Scarborough.
And I'm Natalie Pasquarella. It's something that New York City parents have been dreading. The city's 7-day coronavirus positivity rate hit 3%, shutting down schools until further notice starting tomorrow. Now, this is despite a very low positivity rate within the schools themselves. Of the more than 130,000 students and staff tested, only 0.2% came back positive. Well, now more restrictions could be on the way. The governor said the city would soon become an orange zone. So this doesn't just include schools, but it includes restrictions on non-essential businesses as well. We have you covered tonight. Team coverage of the situation here and in New Jersey as well. I want to start with News 4's Andrew Siff live in Carroll Gardens with the unusual way that all of this was relayed to the nervous parents out there today, Andrew.
Right, Natalie. Well, there are a lot of complex aspects to this, including the fact that the state and the city don't even use the same standards of tracking COVID data. More on that in a moment. But first, the mayor did say he warned parents on Friday to prepare for closure this week, and it is happening. Starting tomorrow, all public school buildings in the city will be closed to students with no indication of when they'll open again. As parents waited to pick up their kids today, they didn't know if there would be school tomorrow.
Truthfully, I think they should close it. To me, it's too much risk.
The closure became official just after 2 p.m. Mayor de Blasio tweeted the news even after some principals got a heads up, and nearly 5 hours after the mayor's scheduled news conference. A camera lingered on an empty chair in City Hall until de Blasio finally appeared after 3.
Unfortunately, as of today, on our 7-day rolling average for coronavirus positivity, New York City has hit exactly 3.0%. And as a result, we do need to close our schools for the coming days.
Some of the day's uncertainty seemed to surround data. The city's 7-day average COVID positivity is only 2.5% according to state data, but 3.0 according to city health officials.
We had to have that conversation with the state. They have the ultimate authority. We had to have that conversation with them to get everyone on the same page.
The governor today warned the COVID surge may soon force more restrictions. He said the city is within its rights to close schools at that 3.0% level. And the whole city might soon be designated an official orange zone that would mandate closure.
If New York City wanted to reopen the schools, we'd have to design a different formula for New York City, because by volume, we couldn't test every student in New York City.
The teachers union, which signed off on the 3% threshold in September, today said reducing COVID spread is the only path forward.
I am pleading with all New Yorkers to help us get our schools open again.
Until then, learning is remote only for hundreds of thousands of city students, adding anxiety for countless parents.
The laptops be messed up. You can't log in. You can't join in the meeting. No one knows what's going on. They run out of laptops. This is the best thing. If they do this, our kids lose our education.
And remote learning means every student is entitled to either an iPad or a laptop, and the school's chancellor acknowledged today about 60,000 kids still need to get their devices to complete remote learning. We're live in Brooklyn. Andrew Siff, News 4 New York.
All right, Andrew, thank you. And as Andrew mentioned, families were kept in suspense about the closures until mid-afternoon today. The news of the closures also appeared to catch Governor Cuomo by surprise in the middle of a news conference. News 4's Rana Levini is live in the newsroom. And Rana, the governor got very heated today with reporters.
Yeah, he did, Chuck. And, you know, parents were listening in. They were trying to understand whether or not schools would be open or closed tomorrow, because at that point we hadn't heard from the mayor yet. Reporters tried to get answers from the governor, but things quickly got heated.
As families waited for answers on citywide school closures, Governor Cuomo weighed in, muddying the waters. And when reporters tried to get clarity, things got heated.
And for the millions of parents who want to know, are the schools going to open tomorrow in New York City?
All right. First of all, let's try not to be obnoxious and offensive in your tone, because you're 100% wrong. These laws have all been in effect for months.
That exchange led to this.
Parents are still confused as well. The schools in New
they're
York
not
City
confused.
tomorrow.
You're confused.
No, I think
But
parents
read the
are
law,
very confused as well.
Read the law, and you won't be confused.
While the governor spoke, the mayor tweeted that city schools will in fact be closed starting tomorrow. That seemed to surprise the governor, though he says the 3% threshold was the plan all along.
The mayor, who has said 57 times, if they hit 3%, we will close.
The governor also pointed out high positivity rates in western New York, where he thinks people aren't taking the virus seriously enough. When asked what the increase in cases says about New York's fight against COVID.
We're fourth in the United States of America after having had the highest infection rate in the United States of America. New Yorkers are doing a great job, and don't demean them, because the entire world is going up. It's disrespectful to New Yorkers.
And the governor also predicted a spike in cases after the Thanksgiving holiday. He once again urged New Yorkers to limit the size of their gatherings. Reporting live in the newsroom, Rana Novini, News 4 New York.
All right, Rana, thank you. Let's take a look at the positivity rate across the tri-state. As you can see, all those numbers are up. The biggest problem still in New Jersey. We see the rate there now double that of the rest of the tri-state. Want to take a deeper dive into New Jersey now. Cases and hospitalizations are up, but the daily number of deaths is down slightly. Let's get out to News 4's Brian Thompson, continuing our team coverage. Brian, where the governor says that the trends show the worst days are yet to come.
Oh, absolutely. And he's very fearful about that, very cautious about it in what he's actually announcing or being able to announce. You can see behind me and look over there at the end of the line of a 2-hour testing session here in Asbury Park from 4 to 6 p.m. They still have a few people left to process. This was crowded all during this 2-hour slot. But yes, the governor says these numbers are rising dramatically. The hellscape inside New Jersey hospitals last spring is on track for a rerun this winter as numbers relentlessly climb across the state. One model based on whatever precautions people are taking right now.
The 8,000 to 10,000 a day were models that I looked at, Judy, that assumed current behavior, did not assume the personal responsibility or steps or further steps that we could take.
At Jersey Shore University Medical Center, 7 new COVID cases came in over the past 24 hours, and doctors there see little chance of it leveling off soon.
I would love to say yes, but the scientists and the physician in me say no. I think the virus is out in the community, and I think it's there, and I think we're going to see this trend continue for the next little while.
On a daily basis, this hospital debates whether to ban most patient visitations, as 2 sister hospitals in Hackensack and Toms River decided to do just this week. Lines like this at the testing center here in Asbury Park suggesting it will get worse. Terry Harms, picking up her husband after a relatively minor operation, remembers friends who couldn't visit their loved ones last spring.
Totally alone, walked themselves into the hospital for major stuff. I'm just very thankful that didn't happen to us, because that would be hard.
Total hospitalizations now stand at nearly 2,500 compared to just over 400 back in September, a nearly 5-fold increase in just 2 months. State Health Commissioner Judy Persicilli adding,
42% are on ventilators, and that's the highest percent of individuals that we've had on ventilators for quite a long period of time.
Hospitals are keeping beds available for what is now expected to be a surge.
No way.
As Governor Murphy says,
there is no way to sugarcoat any of these numbers. They are not good.
no sugarcoating, and the governor at this point saying that there are no new restrictions coming down the pipe, but he is considering everything as far as staffing for hospitals. We've heard reports elsewhere in the country about staffing issues, but Hackensack Meridian System says right now they're okay. At least at Jersey Shore University Medical Center, they are not putting anybody on extended shifts, although some of their staff have indeed come down with the virus and are in quarantine, out of action for now. So this is a touch-and-go situation just about everywhere across the tri-state, certainly here in New Jersey. Live in Asbury Park, Brian Thompson, News 4 New York.
Well, indeed it is, Brian, and certainly so staffing issues in Connecticut now. Concerns there. In Connecticut, the positivity rate is rising again, now hovering just below 6% statewide. Hospitalizations also jumped to 816. And another 13 people died of COVID-19. And Governor Ned Lamont is warning if things get worse, and they could get worse, the state could face a staffing crisis at hospitals.